I am Tomoyuki Kashima from Oculofacial Clinic Tokyo. My presentation today will be on cosmetic orbital fat decompression. There will be QR codes on my clinic and surgery video in my presentation. So please have smartphone ready if you are interested. Thank you. Let's talk about my topic, cosmetic orbital fat decompression. I have no financial disclosure. Cosmetic orbital surgery is new concept in oculoplastic region. It refers to the treatment of patients who are bothered by protruding or sunken eyeballs due to disease, accident, or congenital reasons. There are two types of cause for each one is condition from illness and the other is by nature. Cosmetic orbital surgery treats these patients cosmetically. So, there are four types of conditions. We are treating those patients respectively. Let's start with the eye protrusion associated with thyroid eye disease. Almost all oculoplastic doctors think how to do orbital decompression equals how to remove the bone. From orbital anatomy, 4 walls surrounding orbital tissue can be decompressed. The decompression of each 4 walls have each benefit and risks. We must think about the risk of bone decompression. It is a damage to surrounding tissue, outside and inside of bone such as brain, nerves, viscera, and the nasal cavity. The most serious problem is brain injury. The surgeons feel fear for fatal event, and this method have relatively high probability of new onset diplopia. But bone doesn't play any role in thyroid eye disease. Increasing volume of fat have important role for proptosis. Ideally, the target should be something different. Weak points of bone decompression are skin scar, long downtime, and unpredictable result. However, these points become benefit in the fat decompression. We make no scar on the skin, downtime is short, the result is predictable and adjustable. This is the case of a young female. Orbital fat decompression has cured the protruding eyeball. When you look at the arrow in the left eye, you can see that the large protruding eyeball is non-concave. This is my previous case of lateral bone decompression. Even after 6 months, the skin scar remains red. Skin incision can make skin scar. These photos are my cases of lateral decompression in early days. Hematoma and the swelling is very severe. Lower photo shows the result of fat decompression. These show very mild swelling and hematoma even in early days. There is a huge difference among two surgeries, and also this is a big difference for patients. This is a movie of a patient before and after surgery. This is before surgery. She have thyroid eye disease, so she have puffy upper and lower eyelid. It disappeared just after the surgery. Upper and lower eyelid become flat. This is the interview I took after the surgery. The eyeball is already concave immediately after surgery, so the patient feel it when she touch it. So when she look in the mirror,
鏡見てもびっ
the
くり
patient
し
talk
まし
about
た
the shadow
ね。
of the upper eyelid.
はい、影がある
But
眉
when
頭のところに
there's a ocular protrusion, the eyelid bulges
あり
out
がとうございまし
so
た。
that there is no shadow on the eye. Orbital fat decompression is a very useful procedure, but one that carries a risk of blindness. I would like to discuss my commitment to performing this surgery safely. However, needless to say, it is dangerous. Posterior orbit is so dense with muscle, nerves, and viscera. Removing only fat seems like an impossible task. There are 3 points to remove deep orbital fat. To avoid making blind eyes, I recommend 3 points. The first one is using adequate tools. First of all, I strongly recommend to use microscopes. We always use microscope for all types of oculoplastic surgery, including orbital fat decompression. Leica M320 is made for dentists. It is so good for oculoplastic surgery and also cheap. It costs about 30,000 US. The microscope is necessary for orbital fat decompression, especially for intracorneal fat resection. And the spatula is a good tool for embedding deep orbit without damaging important organ. The second is looking closely at anatomy. So let me categorize orbital fat. The first is extracorneal fat. The role of extracorneal fat is a structure supporting eyeball and muscle cone. So it is relatively hard and strongly adhering bone, tendon, and muscle. Inside of extracorneal fat, no important structure exists, so you can remove it all. The second is intercorneal fat. The role of intercorneal fat is a cushioning material for intercorneal nervous vessels during eye movement. It is very soft, loose, and indefinite. Intercorneal fat contains important structure for visual system. You cannot remove blindly. Then, which area of orbital fat can be removed? This MRI is from the patient of thyroid eye disease. Of course, orbital fat can be removed from 4 quadrants, avoiding 4 rectus muscles. And last, just behind the lacrimal caruncle, orbital fat of lower quadrant can be removed from inferior fornix, and the upper quadrant can be removed from upper eyelid crease. The third is applying adequate skills. To remove extracorneal fat, you can just remove it roughly with adequate knowledge of orbital anatomy. For intracorneal fat, you must remove intracorneal fat gently, using 2 spatula. Push aside 2 rectus muscles for each quadrant. Then intercorneal fat will pop out from the intermuscular septum. The fat should be unraveled before removing, and only loosened fat can be removed. Intercorneal fat contains tiny fibers, but important nerves and arteries. The patient is a female, approximately 30 years old. She has a fatty hyperplasia of both upper and lower eyelid with ocular protrusion. Postoperatively, both upper and lower eyelid show improvement in the adipogenesis. There seems to be no fat gain due to thyroid eye disease. Here is a comparison of pre- and postoperative results. Pre-operatively, the eyes had a glaring look due to the protruding eyeballs caused by the fat gain. Both the upper and lower eyelids have been flattened, giving a beautiful impression. The second case, 30 years old female. After onset of thyroid eye disease, her appearance has completely changed. After 2 types of fat decompression, she was back to her old self. One of the advantages I want to emphasize is that fat decompression can change the pupil distance. Thyroid eye disease makes both eyes apart. Removing fat of just behind the lacrimal caruncle, where the medial portion of eyeball, eyes become closer. I am constantly making refinements to improve the result of my surgeries. Recently, we have found that fat removed from the deep orbit can be grafted into the area of the cheek, where the ligament has been removed, resulting in an almost complete lower eyelid reconstruction. I would like to show you how this can be done. Dark circles in the eyes are a very troublesome problem for patients with thyroid eye disease. Recently, we have performed a lower eyelid reconstruction with good results by grafting orbital fat removed during orbital fat decompression. There are 2 reasons for dark circles in the eye. The first is due to increased fat. The second is due to the ligaments under the orbit. In thyroid eye disease, there is an increase in the fat, which causes fat prolapse and make dark circles more prominent. To explain again, not only does not fat increase in the escape, but the ligaments pull, creating a gap here and a shadow. Therefore, the most important thing to cure dark circle in the eye is to invalidate the ligaments. If the ligament is just cut, it will stick back together again. So the fat on the top will complete the deactivation of the ligament. By removing the ligaments and moving and inserting fat, the ligaments are disabled, thereby obtaining a flat lower eyelid. I have recently applied this concept to orbital fat decompression. Let me show you the cases. Before surgery, you can see that the eyes are swollen and the eyes are large. Dark circles appear not only on the upper eyelids but also on the lower eyelids. The distance between the eyes also appears to be widened. Postoperatively, the puffiness of upper eyelid has disappeared and the natural shapes of the eye has been achieved. The dark circles on the lower eyelid have also disappeared, and the distance between the eyes has narrowed. Let's take a closer look. The upper eyelid originally had no shadow, but a slight concavity appeared postoperatively, creating a shadow. The white area of the eyes have been reduced, and the square show, which was present, have also improved. You can see that the dark circles on the lower eyelid have healed to near perfection. Case number 2. Before surgery, you can see that the eyes are swollen and the eyes are large. Not only the upper eyelids but also the lower eyelids are concave, making shadows more noticeable. The distance between the eyes also appears to be widened. After surgery, the puffiness of upper eyelid has disappeared, and a natural shape has been achieved. The dark circles of the lower eyelid have also disappeared, and the distance between the eyes has narrowed. This is a recent patient. I will show you a movie. You may know how beautiful changed the face by my surgery. Finally, we have applied this special procedure to a patient who have protruding, bulging eyes by nature. Of course, this is a completely cosmetic procedure, but it is highly satisfactory. This will be explained in the next section. Finally, I would like to discuss its application to patients with congenital ocular protrusion. Patients with long ocular axis length associated with myopia may have a facial appearance that resembles ocular protrusion, and some people may feel inferior to it. We apply orbital fat decompression to such patients and perform cosmetic decompression. Let me show some of the cases. Before surgery, the eyelids are swollen and the eyes are large. The lower eyelid is pulled back, exposing the white of the eye under the black eye. After surgery, the puffiness of the upper eyelid has disappeared and a natural shape has been achieved. The distance between the eyes has also narrowed. The position of the lower eyelid has also been improved, and the whites of the eye is less exposed. Let me zoom in. There are 3 spaces I want you to look. The volume of upper eyelid and the area of white area. Also, I want to compare before and surgery to see the lower scleral exposure is gone after surgery. I want you to compare before and after surgery. Please compare with orbital view. Before surgery, you can see that the eyes are swollen and the eyes are large. The lower eyelid is pulled back, exposing the white of the eye under the black eye. But after surgery, the puffiness of upper eyelid has been disappeared, and a natural shape has been achieved. The position of the lower eyelid has also been improved, and the whites of the eye is less exposed. I hope all of you understand the benefit of fat decompression. You may ask next, what about the risk of this surgery? Yes, there are several risks. This decompression have a huge benefit in compared with the other types of orbital decompression. However, various risks also exist. These risks are loss of peripheral binocular vision, ciliary ganglion injury, globe displacement, ophthalmic artery rupture, and optic nerve injury. The risk is rare but severe complication. I will show you a terrible case who loses their vision. This patient is a 44-year-old female. This is a medium ophthalmic artery rupture during surgery. During surgery, complete mydriasis had occurred in this eye. She returned to home at the day, but next day she complained she cannot see anything. Her visual acuity decreased to hand movement and could not recover. Finally, I strongly recommend to use microscopes. When resecting orbital fat, one must avoid injury to nerves, blood vessels, and other tissues. And I also never recommend aesthetic surgeon to do orbital fat decompression because it can make a blind eyes, and aesthetic doctors or plastic doctors cannot understand the meaning of visual acuity. So unless you understand the eye, you cannot do this orbital fat decompression surgery, I think. Orbital fat decompression can treat ocular protrusion caused by thyroid eye disease or by nature. However, since visual function may be impaired, the procedure must be performed using the correct instruments and techniques. Thank you for kind attention. We are proud of cosmetic orbital surgery, and we did over 11,000 oculoplastic surgeries last year. International visiting doctors are very welcome. Thanks again.